Hi, my name's David Mills, and I'd like to speak for a moment on what the true motivation is for the Republican plan, the Paul Ryan plan, to revamp Medicare. Now, the alleged reason for the Ryan plan to change Medicare into a voucher system is to address our budget deficit. That is not the motivation. The reason that we know that the Republicans are not primarily interested in reducing the deficit and are using this plan for that purpose is that in this same budget, the Ryan budget, we are reading about tremendous tax cuts for wealthy individuals, for corporations, that would offset any savings that would be acquired as a result of the Medicare changes. Just a few days ago in the Senate, the Republicans filibustered a plan to get rid of the obscene tax bonuses for the big oil companies. Now, they're gouging us at the pump, $4, $4.50 a gallon, yet we're giving them special tax cuts. They don't need it. So the idea that the Republican plan is to help with the deficit is not the motivation at all. On the other side, the Democrats will say that the reason for the Ryan budget is because the Republicans just don't like old people. They want to just do away with Social Security and Medicare because they don't give a damn about the seniors and they can just be thrown to the wolves. Well, that is likewise not the motivation of the Republicans. So what is the motivation? If it's not really to reduce the deficit, if it's not because they have some intrinsic hatred of old people, what then does motivate the Republicans in their quest to change Medicare? There's an old saying that if you want to know the truth, follow the money. The fact is that the Republicans get millions of dollars every year in contributions from the health insurance industry. As Medicare is currently set up, the health insurance companies are pretty much bypassed when it comes to Medicare. We pay our taxes, we pay that in to the Medicare system. When you go to the hospital, the government then pays the hospital. There's nothing to do with private insurance in many cases. Of course, many people have supplemental policies, but I'm talking about just the primary Medicare. Under the Ryan plan, seniors would be placed into a private system. This would, over a period of years, produce literally hundreds of billions, with a B, billions of dollars in extra revenue for the stockholders, for the Wall Street investors, for the campaign contributors affiliated with the big insurance companies. So instead of the government paying the hospital directly, remember that Medicare has about a 97% efficiency, that 97% of the money that it spends is spent directly on health care. There's a very low overhead. Under the Ryan plan, this money, the government money, instead of going directly, let us say, to the hospitals and to the doctors, it would go to the private insurance companies who have to make a profit and who would take out between 20 and 25% of that amount before passing it along to the hospitals and to the doctors. So the Ryan plan would introduce a completely unnecessary middleman, the health insurance companies, who would do absolutely nothing to benefit the patient other than to suck 20 to 25% of the money out of the system. But because health insurance companies are a big contributor to the Republican Party. The Republican Party wants to reward them by giving the big insurance companies hundreds of billions of dollars in government funds that now go directly to the hospitals and to the doctors and that bypass the health insurance companies altogether. So, to summarize, the motivation behind the Republican plan to change Medicare is not that they're wanting to reduce the deficit, nor is it because they hate old people. The motivation behind the plan is to move massive amounts of money into the coffers of the stockholders of the big insurance companies. That is the motivation. So the question then becomes, well, who would be better off and who would be worse off under the Ryan plan? If you own stock in an insurance company, you would be much better off. If you are wealthy and own stocks in big pharma or a variety of medical-related industries, you will be better off. If you're like me, if you're just an average person of average income, your costs, once you reach eligibility for Medicare, would, according to the Congressional Budget Office, be over $6,000 a year more than it is right now, assuming that you can get insurance at all. And of course, the reason we had Medicare in the first place back in 1965 was because private insurance would not insure the elderly because it was not profitable. So the old saying is very true. If you want to know the truth, follow the money.